Question 1. The risk matrix shows a 6-month-old infant presenting with significant delays in gross motor skills and a parent who expresses skepticism about the need for early intervention services, stating, "He'll catch up when he's ready." What is the most ethical and effective initial approach for the clinical social worker? Option A. Gently educate the parent about typical infant developmental milestones and collaboratively explore their concerns and potential barriers to accessing support services. Option B. Schedule an immediate referral to Child Protective Services due to suspected developmental neglect. Option C. Insist that the parent enroll the infant in a specialized therapy program immediately to prevent further delays. Option D. Focus solely on the infant's developmental deficits during the session, providing the parent with a list of resources without further discussion. Correct answer is B. Schedule an immediate referral to Child Protective Services due to suspected developmental neglect. Explanation. Scenario analysis. This scenario presents a common challenge for clinical social workers involving a young child exhibiting concerning developmental delays and a parent who is resistant to intervention. The professional must balance the child's best interests with the parent's autonomy and potential barriers to engagement. The urgency of early intervention for infant development adds a layer of complexity, requiring a sensitive yet assertive approach. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes building rapport and trust with the parent, while gently educating them about developmental milestones and the benefits of early intervention. This aligns with ethical principles of client self-determination and the social worker's responsibility to promote well-being. Specifically, the ASWB Code of Ethics emphasizes the importance of respecting clients' right to self-determination and engaging in collaborative practice. By offering resources and support without coercion, the social worker empowers the parent to make informed decisions, fostering a stronger therapeutic alliance and increasing the likelihood of successful engagement in services. This approach acknowledges that parental readiness is a crucial factor in effective intervention. Incorrect approach is analysis. One incorrect approach involves immediately escalating to Child Protective Services without further attempts to engage the parent. This fails to respect the parent's autonomy and can damage the therapeutic relationship, potentially leading to further withdrawal and resistance. It bypasses the ethical obligation to explore less intrusive interventions first and assumes neglect or abuse without sufficient evidence beyond developmental concerns. Another incorrect approach is to dismiss the parent's concerns and insist on immediate enrollment in services. This approach disregards the parent's perspective and can be perceived as judgmental or dismissive, undermining trust and rapport. It fails to acknowledge potential barriers the parent might be experiencing, such as financial constraints, lack of understanding, or cultural beliefs, which are critical to address for successful intervention. A third incorrect approach is to solely focus on the child's deficits without addressing the parent's emotional state or readiness for intervention. While the child's development is paramount, ignoring the parent's feelings, anxieties, or potential ambivalence can create resistance. Effective early intervention requires a partnership with the caregiver, and failing to address their needs and concerns will likely hinder progress. Professional reasoning. When faced with a situation involving potential developmental delays in an infant and parental resistance, a clinical social worker should employ a phased approach. First, focus on building a strong, trusting relationship with the parent, actively listening to their concerns and perspectives. Second, provide clear, non-judgmental information about typical infant development and the potential benefits of early intervention, tailoring the information to the parent's understanding. Third, collaboratively explore potential barriers to accessing services and brainstorm solutions together. Fourth, offer a range of options and resources, respecting the parent's right to decide on the pace and nature of intervention. Escalation to Child Protective Services should be a last resort, reserved for situations where there is clear evidence of abuse or neglect that places the child at imminent risk. Question 2. Market research demonstrates that individuals often internalize social norms and values from their upbringing and community, which can significantly influence their current behaviors and decision-making. A social worker is assisting a client who exhibits behaviors that are causing harm to themselves and others, and these behaviors are deeply rooted in the client's family and cultural traditions. The social worker needs to develop an intervention plan that addresses the harmful behaviors while respecting the client's background, Which of the following approaches best aligns with ethical and effective social work practice in this situation? Option A. Focus solely on the immediate consequences of the client's harmful behaviors, without exploring the underlying social influences that contribute to them. Option B. Develop an intervention plan that directly challenges and aims to dismantle the client's ingrained social norms and values, emphasizing the adoption of external, healthier behaviors. Option C. Collaborate with the client to identify how their existing social support systems and learned values can be leveraged to support positive behavioral changes, while gently exploring alternative perspectives and behaviors. Option D. Implement an intervention plan based on the social worker's own cultural values and understanding of ideal behavior, expecting the client to conform to these standards. Correct answer is B. Develop an intervention plan that directly challenges and aims to dismantle the client's ingrained social norms and values, emphasizing the adoption of external, healthier behaviors. Explanation: this scenario is professionally challenging because it requires a social worker to navigate the complex interplay between a client's deeply ingrained socialization experiences and the immediate need for behavioral change. The client's learned behaviors, shaped by their family and community norms, are resistant to external intervention. The social worker must balance respecting the client's cultural background and lived experiences with the ethical imperative to promote well-being and safety. A nuanced approach is needed that acknowledges the power of socialization without allowing it to become an insurmountable barrier to progress. The correct approach involves a strengths-based perspective that integrates the client's existing social capital and values into the intervention plan. This means identifying how the client's current social network and learned norms can be leveraged to support positive change, rather than solely focusing on overcoming them. This aligns with ethical principles of self-determination and cultural competence, as outlined in the ASWB Code of Ethics, which emphasizes working with clients in a way that respects their values and beliefs. It also promotes client engagement by making the intervention feel less alien and more connected to their existing identity. An incorrect approach that focuses solely on confronting and dismantling the client's learned behaviors without acknowledging their origins or potential for positive adaptation would be ethically problematic. This could be perceived as judgmental and disrespectful of the client's socialization, potentially leading to alienation and resistance. It fails to recognize that social norms are powerful determinants of behavior, and that change is more effective when it builds upon, rather than negates, existing social structures. Another incorrect approach that imposes external values and norms without considering the client's socialization context would violate the principle of self-determination. This approach risks pathologizing the client's cultural background and could lead to a power imbalance where the social worker's agenda overrides the client's lived experience. This is contrary to the ethical requirement to empower clients and support their autonomy. The professional decision-making process for similar situations should begin with a thorough assessment of the client's socialization history, including family dynamics, community influences, and cultural values. This assessment should be conducted collaboratively with the client, fostering trust and understanding. The social worker should then identify the specific social norms that are impacting the client's behavior and explore how these norms might be reframed or utilized to support desired changes. The intervention plan should be co-created with the client, incorporating their strengths and existing social support systems. Throughout the process, the social worker must remain mindful of the ASWB Code of Ethics, particularly regarding cultural competence, self-determination, and the promotion of client well-being. Question 3. The control framework reveals that a client reports feeling constantly worried about work, finances, and their children's well-being, experiencing muscle tension and difficulty sleeping for the past 8 months. The client states these worries are hard to control and interfere with their ability to concentrate at work. What is the most appropriate initial clinical action for the social worker to take? Option A. Refer the client to a psychiatrist for immediate medication evaluation to address the reported sleep difficulties and tension. Option B. Conduct a thorough biopsychosocial assessment, systematically exploring the nature, duration, intensity, and impact of the client's worries, and consider differential diagnoses according to established diagnostic criteria. Option C. Advise the client that these feelings are a normal response to life stressors and encourage them to focus on positive coping strategies. Option D. Immediately implement relaxation techniques and suggest mindfulness exercises to manage the client's reported stress. The correct answer is D. Immediately implement relaxation techniques and suggest mindfulness exercises to manage the client's reported stress. Explanation. The control framework reveals a common implementation challenge for clinical social workers, accurately differentiating between normal life stressors and the diagnostic criteria for generalized anxiety disorder, GAD, particularly when a client presents with a constellation of symptoms that overlap with everyday worries. This scenario is professionally challenging because it requires a nuanced understanding of diagnostic criteria, the ability to conduct a thorough biopsychosocial assessment, and the ethical imperative to avoid overpathologizing or underdiagnosing a condition. The ASWB clinical exam emphasizes the social worker's responsibility to apply diagnostic criteria accurately and ethically, ensuring interventions are evidence-based and client-centered. Correct approach involves a comprehensive assessment that goes beyond simply acknowledging the client's distress. It requires systematically evaluating the duration, intensity, and pervasiveness of the anxiety symptoms, as well as their impact on the client's functioning across multiple life domains. This includes exploring the client's history, current stressors, coping mechanisms, and ruling out other potential causes for the symptoms, such as medical conditions or substance use. Adhering to the DSM-5-TR criteria for GAD, which specifies excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities, accompanied by specific associated symptoms, is paramount. This systematic, evidence-based approach aligns with ethical standards of competence and due diligence, ensuring that a diagnosis is made only when warranted and that treatment is tailored to the client's specific needs. An incorrect approach would be to immediately recommend anxiety-reducing techniques or medication referral based solely on the client's report of feeling worried and stressed. This fails to meet the diagnostic threshold for GAD and bypasses the crucial step of differential diagnosis. Ethically, this could lead to unnecessary interventions and potentially mask underlying issues. Another incorrect approach would be to dismiss the client's concerns as simply normal stress without a thorough assessment. This constitutes a failure to adequately assess and could result in a misdiagnosis, leaving the client without appropriate support and treatment, which violates the ethical principle of beneficence. Finally, focusing exclusively on symptom management without exploring the underlying cognitive patterns and behavioral responses associated with excessive worry would be an incomplete approach, potentially leading to superficial or temporary relief rather than addressing the core features of GAD. The professional decision-making process for similar situations should involve a structured assessment framework. This includes active listening to the client's presenting concerns, followed by a systematic exploration of symptom characteristics, frequency, intensity, duration, triggers, impact on functioning. The social worker must then apply relevant diagnostic criteria, e.g., DSM-5-TR for GAD, consider differential diagnoses, and rule out other contributing factors. Based on this comprehensive evaluation, an evidence-based treatment plan can be developed, which may include psychotherapy, psychoeducation, and when appropriate, consultation with medical professionals. Question 4. Stakeholder feedback indicates that clients are increasingly interested in understanding the genetic components of mental health disorders. A client expresses a desire to know about their potential genetic predispositions to conditions like depression and anxiety, citing family history. As a clinical social worker, what is the most appropriate initial approach? Option A. Inform the client that genetic predispositions are beyond the scope of social work and refer them directly to a genetic counselor without further discussion. Option B. Immediately provide the client with a comprehensive list of known genetic markers associated with depression and anxiety, along with statistical probabilities. Option C. Explore the client's understanding of genetics, their reasons for this inquiry, and their emotional readiness to discuss potential genetic predispositions, offering to provide information in a supportive and accessible manner. Option D. Advise the client that discussing genetic predispositions is likely to cause them unnecessary anxiety and suggest focusing on current coping strategies instead. The correct answer is C. Explore the client's understanding of genetics, their reasons for this inquiry, and their emotional readiness to discuss potential genetic predispositions, offering to provide information in a supportive and accessible manner. Explanation. This scenario is professionally challenging because it requires a social worker to navigate the complex intersection of genetic predispositions, client autonomy, and the ethical imperative to provide accurate and sensitive information. The ASWB clinical exam emphasizes the importance of informed consent, client self-determination, and the responsible dissemination of potentially sensitive information. A social worker must balance the client's right to know with the potential for anxiety or distress that genetic information might cause, while also adhering to professional ethical standards that prioritize client well-being and confidentiality. The correct approach involves a thorough assessment of the client's understanding, readiness, and potential impact of genetic information. This includes exploring the client's current knowledge, their reasons for seeking this information, and their coping mechanisms. The social worker must then provide information in a clear, accessible, and non-judgmental manner, emphasizing that genetic predispositions are not deterministic and that lifestyle and environmental factors play significant roles. This approach aligns with the ASWB Code of Ethics, particularly the principles related to competence, integrity, and the dignity and worth of the person. It respects client autonomy by empowering them to make informed decisions about their health and well-being, while also fulfilling the social worker's duty to provide accurate and relevant information in a supportive context. An incorrect approach that immediately provides a detailed list of genetic predispositions without assessing the client's readiness or understanding fails to uphold the principle of client self-determination and may cause undue distress. This approach bypasses the crucial step of ensuring the client is prepared to receive and process such sensitive information, potentially leading to anxiety, hopelessness, or misinterpretation of the data. It also risks overstepping professional boundaries by presenting information that the client may not be equipped to handle at that moment. Another incorrect approach, which is to dismiss the client's inquiry by stating that genetic information is too complex or not relevant to social work practice, is ethically unsound. This response fails to acknowledge the significant impact of heredity and genetic predispositions on mental health and overall well-being, which are central to a social worker's scope of practice. It also neglects the client's expressed need for information and support, potentially damaging the therapeutic alliance and hindering the client's ability to engage in self-advocacy and informed decision-making. A third incorrect approach, which is to refer the client to a genetic counselor without first exploring the client's immediate needs and understanding, is also problematic. While referral to specialists is often appropriate, a social worker should first engage in a supportive conversation to understand the client's concerns and provide initial psychoeducation. A premature referral can feel dismissive and may not adequately address the client's emotional and psychological state surrounding the inquiry. A professional decision-making process for similar situations should begin with active listening and empathetic exploration of the client's concerns. The social worker should assess the client's current knowledge, emotional state, and readiness to engage with potentially sensitive information. This assessment informs the provision of information, which should be tailored to the client's understanding and delivered in a supportive and non-judgmental manner. Ethical guidelines and professional competence dictate that social workers provide accurate information while respecting client autonomy and prioritizing their well-being. When complex genetic information is involved, it is crucial to collaborate with other professionals, such as genetic counselors, but only after a foundational assessment and initial support have been provided by the social worker. Question 5. Benchmark analysis indicates that a 15-year-old client who has been increasingly withdrawn and secretive admits to experimenting with substances at parties with peers. The client expresses a desire to fit in and states they don't believe the substances are harmful, as everyone is doing it. The social worker needs to determine the most appropriate initial course of action. Which of the following approaches best aligns with ethical and regulatory guidelines for assessing and addressing this situation? Option A. Immediately inform the client's parents about the substance experimentation, emphasizing the perceived danger and the need for parental intervention to stop the behavior. Option B. Dismiss the client's statements as typical adolescent risk-taking and peer pressure, and continue with the previously established treatment goals without further investigation into the substance use. Option C. Conduct a comprehensive risk assessment that explores the frequency, quantity, and perceived consequences of substance use, while also assessing the adolescent's peer group dynamics and underlying motivations for use, and collaboratively develop a safety plan. Option D. Focus solely on educating the adolescent about the severe health risks associated with substance use, assuming that increased knowledge will deter future experimentation. The correct answer is C. Conduct a comprehensive risk assessment that explores the frequency, quantity, and perceived consequences of substance use, while also assessing the adolescent's peer group dynamics and underlying motivations for use, and collaboratively develop a safety plan. Explanation. This scenario is professionally challenging because it requires the social worker to balance the adolescent's developing autonomy and identity formation with the need to ensure safety and address potential risk-taking behaviors. The adolescent's abstract thinking allows them to rationalize their actions, making direct confrontation less effective and necessitating a more nuanced approach. Careful judgment is required to avoid alienating the adolescent while still fulfilling the social worker's duty of care. The correct approach involves a comprehensive risk assessment that prioritizes safety while respecting the adolescent's developmental stage. This includes gathering information from multiple sources, assessing the adolescent's understanding of risks and consequences, and collaboratively developing a safety plan. This aligns with the ASWB Code of Ethics, which emphasizes the importance of client self-determination, confidentiality, and the responsibility to protect clients from harm. Specifically, the code guides social workers to respect and promote the right of clients to self-determination, while also providing services in a manner that is sensitive to cultural and individual differences and promotes client empowerment. Furthermore, the duty to protect involves assessing and mitigating potential harm, which is paramount when dealing with risk-taking behaviors. An incorrect approach that focuses solely on immediate cessation of the behavior without exploring the underlying reasons, or the adolescent's perspective fails to acknowledge the complexities of identity formation and peer influence. This can lead to increased resistance and a breakdown in the therapeutic relationship, violating the ethical principle of client empowerment and self-determination. Another incorrect approach that involves immediately reporting the behavior to parents or authorities without a thorough assessment and discussion with the adolescent can breach confidentiality and damage trust. While parental involvement may be necessary, it should be a collaborative decision, whenever possible, and based on a clear assessment of risk and the adolescent's capacity to understand and manage the situation. This violates the ethical principles of confidentiality and informed consent. Finally, an approach that dismisses the adolescent's concerns or rationalizations as simply typical teenage behavior without a thorough risk assessment fails to address potential underlying issues and could overlook serious risks. This neglects the social worker's responsibility to assess and intervene when there is a risk of harm to the client or others. The professional decision-making process for similar situations should begin with a thorough assessment of the presenting problem, considering the adolescent's developmental stage, identity formation, peer influences, and cognitive abilities. This assessment should involve direct communication with the adolescent, exploring their perspective, understanding their motivations, and collaboratively identifying potential risks and protective factors. The social worker must then weigh the adolescent's right to self-determination against the duty to protect, adhering to relevant ethical codes and legal mandates. Developing a safety plan that is agreeable to the adolescent, whenever feasible, and involves appropriate collateral contacts, e.g., parents, guardians, based on the assessed risk level, is crucial. Ongoing monitoring and reevaluation of the situation are also essential components of effective practice. Question 6. Upon reviewing a new client's case, a social worker notes a history of significant family conflict, and the client's expressed desire to keep their therapy private from their family. The client has indicated that their family often intervenes in their personal affairs, leading to increased distress. The social worker is considering how to best address the client's presenting issues, which appear to be influenced by these family dynamics. Which of the following approaches best reflects ethical and effective social work practice in this situation? Option A. Encourage the client to share details of their therapy sessions with their family to foster transparency and potentially reduce family conflict. Option B. Focus on the client's individual issues without exploring the family dynamics, as the client has requested privacy and direct family involvement could be perceived as a breach of trust. Option C. Prioritize the client's expressed desire for privacy and focus solely on individual therapy, while acknowledging the family's influence in session without direct intervention with the family unless the client explicitly requests it and provides informed consent. Option D. Immediately contact the client's family to schedule a family session, believing that direct intervention is necessary to resolve the underlying family conflict that is impacting the client. The correct answer is C. Prioritize the client's expressed desire for privacy and focus solely on individual therapy, while acknowledging the family's influence in session without direct intervention with the family unless the client explicitly requests it and provides informed consent. Explanation: this scenario is professionally challenging because the social worker must navigate complex family dynamics and communication patterns while adhering to ethical principles and legal mandates regarding client confidentiality and informed consent. The family's history of conflict and the individual client's expressed desire for privacy create a delicate balance. The social worker must prioritize the client's autonomy and well-being, while also considering the potential impact of family involvement on the client's progress. Careful judgment is required to ensure that interventions are client-centered and respect the boundaries of the therapeutic relationship. The correct approach involves a thorough assessment of the family system and the client's individual needs and preferences. This includes understanding the communication patterns within the family, identifying potential enmeshment or disengagement, and exploring the client's perception of their role and influence within the family. The social worker should then collaboratively develop a treatment plan with the client that addresses their goals and concerns, while also considering the family's impact. This approach aligns with the ASWB Code of Ethics, particularly the principles of self-determination, informed consent, and the importance of considering the client in their environmental context. It also respects the client's right to privacy and confidentiality, ensuring that any family involvement is consensual and serves the client's best interests. An incorrect approach would be to unilaterally decide to involve the family without the client's explicit consent, even if the social worker believes it would be beneficial. This violates the client's right to self-determination and confidentiality, as mandated by ethical codes and potentially by state laws governing social work practice. Another incorrect approach would be to dismiss the family's influence entirely, focusing solely on the individual without acknowledging the systemic factors contributing to the client's difficulties. This overlooks the core tenets of family systems theory and can lead to incomplete or ineffective interventions. Finally, an approach that prioritizes the social worker's agenda over the client's expressed wishes, such as pushing for family therapy when the client is resistant, would be unethical and detrimental to the therapeutic alliance. The professional decision-making process for similar situations should begin with a comprehensive assessment of the client and their presenting concerns, including their family context. This assessment should be collaborative, involving the client in identifying their needs and goals. Ethical principles, such as self-determination, confidentiality, and beneficence, should guide all decisions. The social worker must be aware of relevant legal mandates and agency policies. When family involvement is considered, it should be approached with caution, ensuring informed consent and prioritizing the client's autonomy and safety. Open communication with the client about potential benefits and risks of any intervention is crucial. Question 7. The risk matrix shows a client presenting with increasing impulsivity and memory deficits, potentially indicative of early-stage neurodegenerative changes. The client's adult children have expressed significant concern to the social worker about their parents' safety at home and have requested access to the client's treatment information to help manage the situation. The social worker has not yet discussed the possibility of a neurological disorder with the client. What is the social worker's most ethical and legally sound course of action? Option A. Schedule a joint meeting with the client and their children to discuss the children's concerns and the client's current functioning, without initially disclosing specific diagnostic information. Option B. Inform the client's children that due to confidentiality laws, no information can be shared without the client's explicit written consent, and advise them to seek legal counsel regarding guardianship. Option C. Discuss the possibility of a neurological disorder with the client, assess their understanding and capacity to consent to sharing information with their children, and explore the client's wishes regarding family involvement. Option D. Immediately provide the client's children with all treatment information and a summary of concerns, explaining that their involvement is necessary for the client's safety. The correct answer is C. Discuss the possibility of a neurological disorder with the client, assess their understanding and capacity to consent to sharing information with their children, and explore the client's wishes regarding family involvement. Explanation: This scenario is professionally challenging because it requires the social worker to integrate complex neurobiological information with ethical and legal obligations concerning client confidentiality and informed consent, particularly when a client's cognitive functioning may be impaired. The social worker must balance the client's right to privacy with the potential need for intervention to ensure safety and well-being, all while adhering to the ASWB Code of Ethics and relevant state laws regarding mental health and confidentiality. The correct approach involves obtaining informed consent from the client for any disclosure of information, even to family members, and exploring the client's understanding of their condition and the implications of their symptoms. This aligns with the ASWB Code of Ethics principles of client self-determination and confidentiality. Specifically, Standard 1.05 Confidentiality and Privacy emphasizes that social workers should protect clients' right to privacy and that disclosure of confidential information should only occur with the client's informed consent, except in specific legally mandated situations, e.g., imminent danger to self or others. If the client's cognitive impairment prevents them from providing informed consent, the social worker must follow legal and ethical guidelines for situations involving diminished capacity, which may involve seeking consent from a legal guardian or exploring legal avenues for intervention if there is a clear and present danger. An incorrect approach would be to immediately disclose the client's diagnosis and symptoms to the family without the client's explicit consent. This violates the principle of confidentiality and the client's right to self-determination. Another incorrect approach would be to dismiss the family's concerns without further assessment, potentially neglecting a duty to protect if the client's condition poses a risk. Failing to assess the client's capacity to consent or to explore less intrusive interventions before considering disclosure also represents a failure in professional judgment and adherence to ethical standards. Professionals should employ a decision-making framework that prioritizes client autonomy and confidentiality. This involves a thorough assessment of the client's capacity to consent, exploring the client's perspective and wishes, and considering the least intrusive means to address any identified risks. When cognitive impairment is suspected, a careful evaluation of capacity is paramount, and if capacity is lacking, the social worker must consult relevant legal statutes and ethical guidelines for acting in the client's best interest while respecting their rights as much as possible. Question 8. The efficiency study reveals that a client with a chronic autoimmune condition and a progressive mobility impairment is experiencing increased social isolation and expressing feelings of hopelessness. The social worker's primary goal is to ensure the client's safety and well-being. Which of the following approaches is most appropriate for the initial risk assessment? Option A. Directly inquire about suicidal ideation and assess the client's immediate safety by exploring their intent, plan, and access to means, while also exploring how their physical health and disability are impacting their mood and daily functioning. Option B. Recommend that the client seek support from a peer group for individuals with similar chronic illnesses, assuming their hopelessness is a common reaction. Option C. Focus the assessment primarily on the client's adherence to their prescribed medical treatment for the autoimmune condition and their physical therapy regimen for the mobility impairment. Option D. Prioritize gathering detailed medical records from the client's physicians to understand the full scope of their physical health challenges before discussing their mental health concerns. The correct answer is A. Directly inquire about suicidal ideation and assess the client's immediate safety by exploring their intent, plan, and access to means, while also exploring how their physical health and disability are impacting their mood and daily functioning. Explanation. This scenario is professionally challenging because it requires the social work professional to navigate the complex interplay between a client's physical health condition and their mental well-being, while also considering the practical implications of a disability. The professional must conduct a thorough risk assessment that is sensitive to the client's vulnerability and potential for exacerbation of symptoms due to unmet needs. The ASWB clinical exam emphasizes the importance of a holistic approach, recognizing that physical and mental health are inextricably linked. The correct approach involves a comprehensive risk assessment that prioritizes the client's immediate safety and well-being by exploring the direct impact of the chronic illness and disability on their mental health and daily functioning. This includes assessing for suicidal ideation, self-harm, or any other acute mental health crisis that may be triggered or worsened by their physical condition and its limitations. This aligns with the ASWB Code of Ethics, which mandates that social workers should promote the well-being of clients and protect them from harm. Specifically, Standard 1.0.5, Integrity of the Profession, and Standard 4.0.1, Integrity of the Profession, underscore the ethical obligation to assess and address client needs comprehensively and to act in their best interest, which includes considering all contributing factors to their distress. An incorrect approach would be to focus solely on the physical health diagnosis, without adequately exploring its mental health sequelae. This fails to acknowledge the biopsychosocial model that is foundational to social work practice and is implicitly supported by ASWB standards. Another incorrect approach would be to dismiss the client's reported mental health concerns as solely a consequence of their physical illness, thereby underestimating the severity of their mental distress and potentially delaying appropriate mental health interventions. This neglects the ethical imperative to take client self-reports seriously and to conduct a thorough assessment of all presenting problems. Furthermore, an approach that does not consider the impact of the disability on the client's ability to access resources or adhere to treatment plans would be incomplete and potentially harmful, as it fails to address practical barriers to well-being. The professional decision-making process for similar situations should involve a systematic assessment that begins with establishing rapport and actively listening to the client's concerns. The social worker must then identify potential risks to the client's safety and well-being, considering both immediate and long-term implications. This involves exploring the client's subjective experience of their physical health condition, its impact on their mood, thoughts, and behaviors, and any functional limitations imposed by their disability. The assessment should also include an evaluation of the client's support systems, coping mechanisms, and access to resources. Based on this comprehensive assessment, the social worker can then develop an intervention plan that addresses the identified needs and risks in a manner consistent with ethical guidelines and best practices. Question 9. Examination of the data shows a 7-year-old child exhibiting difficulties with problem-solving tasks that require abstract reasoning, yet demonstrating proficiency in tasks involving peer collaboration and guided instruction. To best inform intervention planning, which of the following theoretical lenses should the social worker primarily integrate? Option A. Focusing solely on the child's demonstrated limitations within Piaget's formal operational stage, assuming a fixed cognitive ceiling. Option B. Emphasizing Vygotsky's concept of the zone of proximal development without considering the child's current stage of concrete operational thinking. Option C. Acknowledging the child's current concrete operational stage as described by Piaget, while also recognizing the potential for growth within their zone of proximal development as theorized by Vygotsky. Option D. Prioritizing a purely behaviorist approach to reinforce observable problem-solving behaviors, disregarding underlying cognitive processes. Correct answer is C. Acknowledging the child's current concrete operational stage as described by Piaget, while also recognizing the potential for growth within their zone of proximal development as theorized by Vygotsky. Explanation. This scenario presents a professional challenge because a social worker must accurately assess a child's cognitive abilities to inform intervention strategies, while also respecting the child's developmental stage and the influence of their environment. Misinterpreting a child's cognitive functioning can lead to ineffective or even harmful interventions. The social worker needs to apply theoretical frameworks appropriately to understand the child's current capabilities and potential for growth. The correct approach involves utilizing both Piaget's and Vygotsky's theories to understand the child's cognitive development. Piaget's stages provide a framework for understanding the typical progression of cognitive abilities, helping to identify the child's current operational stage. Vygotsky's sociocultural theory emphasizes the role of social interaction and the zone of proximal development, ZPD, in learning. By considering both, the social worker can assess what the child can do independently, Piaget's influence, and what they can achieve with support from more knowledgeable others, Vygotsky's ZPD. This integrated understanding allows for the development of tailored interventions that build upon the child's existing skills while leveraging social support for further development, aligning with ethical practice principles of client-centered care and evidence-based interventions. An incorrect approach would be to solely rely on Piaget's stages, without considering Vygotsky's emphasis on social interaction. This could lead to an underestimation of the child's potential if they are operating within their ZPD, but not yet independently demonstrating certain cognitive skills. It fails to acknowledge the crucial role of social context in learning and development. Another incorrect approach would be to focus exclusively on Vygotsky's ZPD without a foundational understanding of Piaget's developmental stages. This might lead to interventions that are too advanced or too simplistic for the child's current cognitive capabilities, potentially causing frustration or disengagement. It overlooks the sequential nature of cognitive development as described by Piaget. A third incorrect approach would be to assume the child's cognitive abilities are fixed and unchangeable, without considering the dynamic interplay of individual development and environmental influences. This static view would hinder the development of effective interventions aimed at fostering growth and learning. The professional reasoning process for similar situations should involve a thorough assessment of the client's current functioning, considering both individual developmental milestones and the impact of their social and cultural environment. This requires integrating relevant theoretical frameworks, such as Piaget's and Vygotsky's, to gain a comprehensive understanding. Interventions should then be designed to be developmentally appropriate and to leverage the client's strengths and support systems, always adhering to ethical guidelines that prioritize client well-being and progress. Question 10. Assessment of a 9-year-old client who reports feeling excluded by peers at school and is experiencing a decline in academic performance. The social worker needs to determine the most appropriate intervention strategy. The child expresses a strong desire to avoid school and social interactions. Option A. Immediately implement strategies to reduce the child's school attendance to alleviate immediate distress and allow them to avoid negative peer interactions. Option B. Focus solely on reinforcing parental directives to ensure the child complies with school attendance and peer engagement, disregarding the child's expressed feelings of exclusion. Option C. Advise the child to ignore the peer exclusion and focus on individual academic pursuits, assuming their self-esteem will improve with academic success. Option D. Conduct a comprehensive developmental assessment to understand the child's cognitive abilities and emotional maturity in relation to peer dynamics and school demands, while also exploring parental concerns and school observations. Correct answer is D. Conduct a comprehensive developmental assessment to understand the child's cognitive abilities and emotional maturity in relation to peer dynamics and school demands, while also exploring parental concerns and school observations. Explanation. This scenario presents a professional challenge because the social worker must balance the child's expressed desire for autonomy with the ethical and legal obligations to ensure their safety and well-being, particularly concerning their cognitive development and understanding of consequences during middle childhood. The social worker needs to assess the child's capacity to make informed decisions about their peer relationships and school experiences, recognizing that cognitive abilities are still developing and self-esteem can be fragile. The correct approach involves a comprehensive assessment that prioritizes the child's developmental stage and capacity for understanding. This means engaging the child in age-appropriate dialogue, observing their interactions, and gathering information from multiple sources, parents, teachers, while maintaining confidentiality as much as possible. The social worker must then use this information to determine the best course of action that supports the child's healthy development, addresses any potential risks, and respects their emerging sense of self. This aligns with the ASWB Code of Ethics, which emphasizes the social worker's responsibility to promote the well-being of clients and to respect their right to self-determination, while also recognizing the need to protect vulnerable individuals, especially children, when their capacity for self-protection is limited. An incorrect approach would be to solely rely on the child's stated preferences without a thorough assessment of their cognitive understanding and the potential impact on their self-esteem and school experiences. This could lead to decisions that are not in the child's best interest, potentially exacerbating existing problems or creating new ones. Another incorrect approach would be to dismiss the child's feelings and concerns, treating them as incapable of contributing to decisions about their own lives. This disregards the importance of fostering a sense of agency and can negatively impact their developing self-esteem. Finally, an approach that focuses exclusively on parental concerns without adequately exploring the child's perspective and developmental needs would also be ethically problematic, as it fails to consider the child as an individual with their own rights and experiences. The professional decision-making process should involve a multifaceted assessment, including direct observation, interviews with the child and relevant adults, and consideration of developmental milestones. The social worker should utilize their knowledge of child development to interpret the information gathered and make a judgment that supports the child's best interests, while also empowering them within the limits of their developmental capacity. Question 11. Which approach would be most effective for a social worker assisting a client who expresses a strong desire to achieve a significant career advancement, but appears to be struggling with consistent attendance at work, interpersonal conflicts with colleagues, and significant financial instability? Option A. Immediately focus on developing a strategic plan for career advancement, including resume building and networking, as this is the client's stated primary objective. Option B. Prioritize exploring the client's unmet physiological and safety needs, such as housing and financial security, and their needs for belongingness and esteem in their current work environment, before focusing on the career advancement goal. Option C. Acknowledge the client's career advancement goal, but suggest that it is a less important concern than their immediate interpersonal conflicts, and recommend focusing solely on resolving those issues. Option D. Gently redirect the client's focus away from career advancement, suggesting that their current struggles indicate they are not ready for such a goal and should instead concentrate on less ambitious objectives. The correct answer is B. Prioritize exploring the client's unmet physiological and safety needs, such as housing and financial security, and their needs for belongingness and esteem in their current work environment, before focusing on the career advancement goal. Explanation. This scenario presents a professional challenge because the client's immediate distress and expressed desire for a specific outcome could overshadow a deeper exploration of their underlying needs and motivations. A social worker must balance the client's autonomy and right to self-determination with the ethical responsibility to facilitate genuine growth and well-being, which may require addressing foundational needs before higher-level aspirations can be effectively pursued. Careful judgment is required to avoid imposing a solution or prematurely focusing on superficial goals. The correct approach involves utilizing Maslow's hierarchy of needs to assess the client's current level of functioning and identify unmet foundational needs that may be contributing to their distress and hindering their progress towards their stated goal. This aligns with the ASWB Code of Ethics, which emphasizes understanding the client within their environment and addressing their needs holistically. By exploring physiological, safety, belongingness, and esteem needs, the social worker can help the client build a stronger foundation, making their pursuit of self-actualization more attainable and sustainable. This approach respects the client's journey and empowers them to identify and address barriers at their root. An incorrect approach that focuses solely on the client's stated goal without exploring underlying needs fails to adhere to the ASWB Code of Ethics principle of promoting client well-being and social justice. Risks offering a superficial solution that does not address the root causes of the client's difficulties, potentially leading to repeated cycles of distress. Another incorrect approach that dismisses the client's stated goal as irrelevant without understanding its significance to the client's sense of self-worth or belonging would violate the ethical principle of respecting the client's dignity and worth. It could alienate the client and damage the therapeutic alliance. Professionals should employ a decision-making framework that begins with active listening and empathetic engagement to understand the client's presenting problem and stated goals. Following this, a needs assessment, informed by theoretical frameworks like Maslow's hierarchy, should be conducted to identify any unmet foundational needs that may be impeding progress. The social worker should then collaboratively develop interventions that address these identified needs, empowering the client to work towards both their foundational and higher-level goals. This process ensures that interventions are client-centered, ethically sound, and promote lasting positive change. Question 12. Implementation of a comprehensive risk assessment for a client presenting with symptoms suggestive of both major depressive disorder and a potential substance-induced mood disorder. The social worker must prioritize which of the following to ensure ethical and effective intervention. Option A. Recommending a referral to a psychiatrist for medication management without a complete diagnostic assessment. Option B. Systematically evaluating the client's risk of self-harm or harm to others, alongside a thorough exploration of their substance use history and its impact on their mood and functioning. Option C. Immediately initiating treatment for major depressive disorder based on the most prominent symptoms presented. Option D. Focusing solely on the client's self-reported symptoms of sadness and hopelessness without exploring potential external contributing factors. The correct answer is B. Systematically evaluating the client's risk of self-harm or harm to others, alongside a thorough exploration of their substance use history and its impact on their mood and functioning. Explanation. This scenario presents a professional challenge because the client's presentation is complex and could indicate multiple underlying mental health conditions. Social worker must accurately differentiate between these possibilities to provide effective and ethical treatment. This requires a thorough risk assessment that goes beyond surface-level symptoms to understand the client's history, current functioning, and potential for harm. The correct approach involves a comprehensive risk assessment that systematically evaluates the client's potential for self-harm or harm to others, considering factors such as suicidal ideation, intent, plan, and access to means, as well as aggressive behaviors or threats. This aligns with the ASWB Code of Ethics, which mandates social workers to protect clients from harm and to practice within their areas of competence. Furthermore, accurate differential diagnosis is crucial for developing an appropriate treatment plan, as mandated by ethical standards that require services to be tailored to the client's needs. An incorrect approach would be to immediately focus solely on a specific diagnosis without a thorough risk assessment. This could lead to misdiagnosis and inappropriate treatment, potentially delaying necessary interventions for immediate safety concerns. For example, focusing only on depressive symptoms without assessing for suicidal intent would be a failure to uphold the ethical duty to protect the client from harm. Similarly, prematurely concluding a diagnosis without considering other possibilities, such as the impact of substance use or trauma, violates the ethical principle of providing competent and evidence-based services. Another incorrect approach would be to rely solely on the client's self-report without corroborating information or objective assessment, which can be unreliable, especially when a client may be experiencing impaired judgment or distress. This neglects the ethical responsibility to gather sufficient information for accurate assessment and intervention. The professional decision-making process for similar situations should begin with a thorough biopsychosocial assessment, prioritizing immediate safety and risk assessment. This involves actively listening to the client, gathering collateral information when appropriate and consented to, and utilizing standardized assessment tools. The social worker should then engage in differential diagnosis, considering all plausible conditions that fit the client's presentation, and document the rationale for the chosen diagnosis. Treatment planning should be collaborative with the client and based on the most accurate diagnosis and identified risks. Ongoing reassessment is critical to ensure the treatment plan remains appropriate and effective. Question 13. Cost-benefit analysis shows that focusing on a client's current developmental tasks and potential for ego strength development is the most efficient path to therapeutic progress. Which psychodynamic approach best supports this cost-benefit analysis for a client presenting with significant interpersonal difficulties in young adulthood? Option A. Focusing on the client's defense mechanisms and their origins in Freud's latency stage. Option B. Emphasizing the exploration of repressed childhood sexual conflicts from Freud's oral and anal stages. Option C. Prioritizing interventions based on Erikson's psychosocial stages to address the crisis of intimacy versus isolation. Option D. Analyzing the client's internal object representations and their impact on current relationships through object relations theory. The correct answer is C. Prioritizing interventions based on Erikson's psychosocial stages to address the crisis of intimacy versus isolation. Explanation. This scenario presents a professional challenge because the social worker must navigate a client's deeply ingrained defense mechanisms and developmental history, which are impacting their current functioning. The challenge lies in selecting an intervention that is theoretically sound, ethically appropriate, and most likely to yield positive outcomes for the client, while respecting their autonomy and the therapeutic relationship. Careful judgment is required to avoid imposing a theoretical framework that may not be a good fit or could inadvertently re-traumatize the client. The correct approach involves utilizing Erikson's psychosocial stages to understand the client's current developmental crisis and identify potential strengths and areas for growth. Erikson's theory provides a framework for understanding the lifespan and the specific psychosocial tasks associated with each stage. By focusing on the client's present developmental challenges, the social worker can tailor interventions to foster ego strength and facilitate healthy resolution of the current crisis, aligning with the ASWB Code of Ethics' emphasis on promoting client well-being and self-determination. This approach acknowledges the client's ongoing development and potential for change. An incorrect approach would be to solely focus on Freud's psychosexual stages and attempt to uncover repressed childhood traumas without considering the client's current developmental context. While Freud's theory is foundational, an exclusive focus on early childhood fixation might overlook the client's present-day struggles and their capacity to address them. This could lead to an overly deterministic view and potentially re-traumatize the client by dwelling on past events without sufficient present-day coping resources. This approach could also be seen as not prioritizing the client's immediate needs and well-being, which is a core ethical principle. Another incorrect approach would be to exclusively apply object relations theory by focusing on the client's internal representations of significant others and their impact on current relationships, without integrating the client's broader developmental stage. While object relations theory offers valuable insights into relational patterns, an isolated application might neglect the specific psychosocial tasks the client is currently facing according to Erickson's framework. This could result in interventions that are too narrowly focused on relational dynamics and fail to address the client's broader developmental needs, potentially hindering their progress. The professional decision-making process for similar situations should involve a thorough biopsychosocial spiritual assessment that considers the client's developmental history, current functioning, and presenting problems. The social worker should then consider various theoretical frameworks, including psychodynamic perspectives, to inform their understanding. The selection of an intervention should be client-centered, evidence-informed, and aligned with ethical principles, prioritizing the client's strengths and capacity for growth within their current developmental stage. Regular reevaluation of the intervention's effectiveness and client progress is crucial. Question 14. During the evaluation of a client presenting with significant anxiety and intrusive thoughts, which of the following diagnostic approaches best aligns with the ASWB clinical exam's emphasis on accurate psychiatric diagnosis and ethical practice? Option A. Prioritizing a diagnosis that is most commonly seen in clinical practice without a thorough differential assessment. Option B. Immediately assigning a diagnosis of generalized anxiety disorder based on the client's primary complaint of worry. Option C. Focusing exclusively on the client's report of intrusive thoughts as the sole determinant of the diagnosis. Option D. Systematically considering and ruling out other potential diagnoses that share similar symptoms with the client's presentation, based on DSM-5 criteria. The correct answer is D. Systematically considering and ruling out other potential diagnoses that share similar symptoms with the client's presentation, based on DSM-5 criteria. Explanation. This scenario is professionally challenging because it requires the social worker to navigate the complexities of differential diagnosis, particularly when symptoms overlap between different psychiatric conditions. The social worker must apply diagnostic criteria accurately while also considering the client's unique presentation and history, adhering to ethical principles of beneficence and non-maleficence. Careful judgment is required to avoid misdiagnosis, which can lead to inappropriate treatment, client harm, and a breach of professional responsibility. The correct approach involves a thorough assessment that systematically considers and rules out other potential diagnoses based on DSM-5 criteria. This approach prioritizes accuracy and client well-being by ensuring the diagnosis is the most fitting explanation for the client's symptoms and functional impairment. This aligns with the ASWB Code of Ethics, which mandates social workers to practice competently and to provide services that are in the best interest of the client. Accurate diagnosis is foundational to effective intervention planning. An incorrect approach that immediately assigns a diagnosis without a comprehensive differential diagnosis process fails to meet the standard of competent practice. This can lead to a misdiagnosis, potentially resulting in the client receiving ineffective or even harmful treatment. Ethically, this shortcuts the diagnostic process, violating the principle of providing services that are in the client's best interest. Another incorrect approach that focuses solely on the most prominent symptom, without exploring other diagnostic possibilities, overlooks the interconnectedness of symptoms and the potential for co-occurring conditions or alternative explanations. This can result in a superficial understanding of the client's presentation and a failure to identify the root cause of their distress, thereby compromising the effectiveness of interventions and potentially leading to client dissatisfaction or continued suffering. A further incorrect approach that relies heavily on client self-report without objective assessment or collateral information can lead to an incomplete or inaccurate diagnostic picture. While client self-report is crucial, it must be integrated with other assessment data to ensure diagnostic validity. Over-reliance on self-report alone can be misleading and may not capture the full scope of the client's challenges. The professional decision-making process for similar situations should involve a systematic and iterative approach to diagnosis. This includes gathering comprehensive information, formulating a differential diagnosis list, systematically evaluating each potential diagnosis against DSM-5 criteria and the client's presentation, and continuously reassessing the diagnosis as more information becomes available or as the client's presentation evolves. Ethical considerations, including client autonomy, beneficence, and non-maleficence, must guide every step of this process. Question 15. Cost-benefit analysis shows that while some cultural practices may present perceived risks according to dominant societal norms, the potential benefits to a client's cultural identity and community cohesion are significant. A social worker encounters a client whose family engages in a traditional practice that raises concerns for the social worker regarding potential physical harm. The social worker must decide how to proceed. Which of the following approaches best aligns with ethical and professional standards for social work practice? Option A. Rely on general knowledge about the client's cultural group to determine the practice's inherent danger and advise the client to discontinue it based on this generalized information. Option B. Immediately intervene to stop the practice, citing potential harm based on external observations and societal standards, without further exploration of its cultural significance or the client's views. Option C. Dismiss the practice as potentially harmful and focus solely on educating the client about the risks, assuming the client is unaware of negative outcomes due to their cultural background. Option D. Engage in a thorough cultural assessment to understand the practice's meaning, function, and the client's perspective, while also assessing for actual harm and exploring the client's informed consent and decision-making capacity regarding the practice. The correct answer is D. Engage in a thorough cultural assessment to understand the practice's meaning, function, and the client's perspective, while also assessing for actual harm and exploring the client's informed consent and decision-making capacity regarding the practice. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between a client's deeply held cultural beliefs and practices, and the social worker's professional obligations to ensure client safety and well-being, particularly when those practices might be perceived as harmful by dominant cultural norms. The challenge lies in navigating this delicate balance without imposing one's own cultural values or pathologizing the client's cultural identity, while still upholding ethical responsibilities. Careful judgment is required to differentiate between cultural expression and potential harm, and to intervene in a way that is respectful and empowering. Correct approach analysis. The correct approach involves a thorough cultural assessment that prioritizes understanding the client's worldview, the meaning and function of the practice within their cultural context, and the client's own agency and consent. This aligns with the ASWB Code of Ethics, which emphasizes cultural competence, self-determination, and avoiding discrimination. Specifically, Standard 105A mandates that social workers should have a clear understanding of their own cultural identities and worldviews and how these affect their interactions with clients. Standard 105B requires social workers to gain knowledge of the history, culture, and social situations of client populations. By seeking to understand the cultural significance and the client's perspective, the social worker respects the client's self-determination and avoids imposing external judgments. Incorrect approach is analysis, an approach that immediately seeks to stop the practice based on external perceptions of harm, without first understanding its cultural context or the client's perspective, fails to uphold the principle of self-determination and can be seen as culturally insensitive or ethnocentric. This could violate Standard 105C, which states social workers should not allow their own biases, prejudices, or values to interfere with their professional judgment. an approach that dismisses the cultural significance of the practice and focuses solely on the potential negative outcomes, without exploring the client's understanding or the practice's role in their life, also risks imposing external values and undermining the client's autonomy. This overlooks the importance of understanding the client's lived experience, a core tenet of ethical social work practice. An approach that relies solely on anecdotal information or stereotypes about the client's culture, without engaging in direct assessment and dialogue with the client, is a failure of cultural competence and can lead to misinterpretations and inappropriate interventions. This directly contravenes the ethical mandate to understand and respect diverse cultural backgrounds. Professional reasoning. Professionals should employ a decision-making framework that begins with self-awareness of their own cultural biases. This is followed by a comprehensive cultural assessment, actively listening to the client's narrative and understanding the meaning of their practices within their cultural context. The next step involves assessing for actual harm, distinguishing between cultural practices and potential risks, and exploring the client's own capacity for informed decision-making. Interventions should be collaborative, client-centered, and culturally sensitive, aiming to empower the client rather than dictate solutions. This process ensures adherence to ethical principles of self-determination, dignity and worth of the person, and competence. Question 16. Performance analysis shows a client experiencing intense emotional dysregulation, frequently expressing overwhelming sadness and anger that significantly impacts their ability to engage in problem-solving during therapy sessions. The social worker recognizes the client's distress is a primary barrier to progress. Which of the following approaches best addresses this implementation challenge? Option A. The social worker actively listens to the client's expressions of emotion, validates their feelings without judgment, and collaboratively explores the triggers for their distress, while also modeling calm and regulated responses and introducing simple grounding techniques. Option B. The social worker immediately shifts the focus to identifying practical solutions for the external stressors the client describes, believing that resolving these issues will alleviate the emotional distress. Option C. The social worker mirrors the client's emotional intensity, expressing similar levels of sadness and anger to demonstrate empathy and build rapport. Option D. The social worker gently suggests to the client that their emotional reactions might be disproportionate to the situations, encouraging them to try and suppress these feelings. The correct answer is A. The social worker actively listens to the client's expressions of emotion, validates their feelings without judgment, and collaboratively explores the triggers for their distress, while also modeling calm and regulated responses and introducing simple grounding techniques. Explanation. This scenario presents a professional challenge because the social worker must navigate a client's intense emotional distress while adhering to ethical obligations and maintaining professional boundaries. The client's emotional dysregulation directly impacts their behavior and their ability to engage constructively in therapy, requiring the social worker to employ advanced emotional regulation and intelligence skills. The challenge lies in balancing empathy and support, with the need to guide the client toward healthier coping mechanisms, without becoming overwhelmed or inadvertently reinforcing maladaptive patterns. Careful judgment is required to assess the client's immediate safety needs, the underlying causes of their emotional state, and the most effective therapeutic interventions. The correct approach involves the social worker modeling and facilitating emotional regulation by validating the client's feelings without judgment, helping them identify the triggers for their distress, and collaboratively exploring coping strategies. This aligns with the ASWB Code of Ethics, which emphasizes the importance of respecting clients' dignity and worth, promoting self-determination, and providing competent services. Specifically, Standard 1.05a on integrity in professional relationships and Standard 4.01a on competence require social workers to be aware of their own emotional states and their impact on clients, and to utilize interventions that are evidence-based and client-centered. By helping the client develop emotional intelligence, the ability to understand and manage their own emotions, and recognize and influence the emotions of others, the social worker empowers them to navigate future challenges more effectively. An incorrect approach that involves the social worker becoming overly emotionally involved or mirroring the client's distress would violate the ethical principle of maintaining professional boundaries. This could lead to vicarious traumatization for the social worker and could inadvertently reinforce the client's maladaptive emotional responses by validating them without offering constructive alternatives. This failure to manage one's own emotional responses and maintain objectivity is a breach of competence. Another incorrect approach, such as immediately attempting to problem-solve the client's external issues without first addressing the overwhelming emotional state, would be ineffective and potentially harmful. This disregards the client's immediate need for emotional containment and validation, failing to acknowledge the impact of emotions on their capacity to engage with problem-solving. This approach neglects the foundational work of emotional regulation, which is a prerequisite for effective behavioral change, and thus falls short of providing competent and ethical care. A third incorrect approach, such as dismissing or minimizing the client's emotions as an overreaction, would be a direct violation of the ASWB Code of Ethics regarding respect for clients' dignity and worth. This approach would likely alienate the client, damage the therapeutic alliance, and prevent any progress in emotional regulation or problem-solving. It demonstrates a lack of emotional intelligence and competence in understanding the client's subjective experience. The professional decision-making process for similar situations should involve a continuous assessment of the client's emotional state, the therapeutic alliance, and the social worker's own emotional responses. It requires a strong foundation in emotional regulation techniques for oneself, the ability to accurately assess the client's emotional needs, and the application of ethical principles to guide interventions. This includes prioritizing safety, validating the client's experience, collaboratively developing coping strategies, and maintaining professional boundaries throughout the process. Question 17. The monitoring system demonstrates that a client has experienced several distinct periods of significantly elevated mood, characterized by increased energy, decreased need for sleep, and racing thoughts, lasting for approximately 1 week each. During these periods, the client reports being highly productive at work and engaging in social activities more frequently than usual, but denies any significant impairment in their occupational or social functioning or any psychotic features. In between these elevated mood periods, the client reports experiencing episodes of depressed mood, characterized by low energy, sadness, and loss of interest in activities. Based on this information, which of the following diagnostic considerations is most appropriate for the clinical social worker to explore further? Option A. Bipolar Roman II disorder, considering the pattern of elevated mood and depressive episodes without reported mania. Option B. Other specified bipolar and related disorder, if diagnostic criteria for other disorders are not fully met. Option C. Bipolar I disorder, given the presence of elevated mood episodes. Option D. Cyclothymic disorder, due to the fluctuating nature of mood symptoms. The correct answer is C. Bipolar I disorder, given the presence of elevated mood episodes. Explanation. This scenario presents a professional challenge because it requires a clinical social worker to differentiate between distinct bipolar and related disorders based on observed symptom patterns and client self-report, while adhering to diagnostic criteria and ethical practice standards. The challenge lies in accurately assessing the severity and duration of mood episodes to arrive at the most appropriate diagnosis, which directly impacts treatment planning and client care. Careful judgment is required to avoid misdiagnosis, which could lead to ineffective or even harmful interventions. The correct approach involves a comprehensive assessment that considers the presence and pattern of manic or hypomanic episodes in conjunction with depressive episodes, as outlined in the DSM-5 criteria for bipolar I, bipolar Roman II, and cyclothymic disorder. Specifically, for bipolar I, the presence of at least one manic episode is required. For bipolar Roman II, the presence of at least one hypomanic episode and at least one major depressive episode is required, with no history of a manic episode. Cyclothymic disorder involves numerous periods of hypomanic symptoms and periods of depressive symptoms that do not meet the criteria for a major depressive episode, occurring for at least 2 years in adults. This approach aligns with the ASWB clinical exam's focus on accurate diagnostic reasoning and evidence-based practice, ensuring that interventions are tailored to the client's specific condition. An incorrect approach would be to diagnose bipolar I disorder solely based on a single reported period of elevated mood, without confirming the presence of a full manic episode, which includes significant impairment in functioning, and may involve psychotic features. This fails to adhere to the diagnostic criteria that distinguish mania from hypomania. Another incorrect approach would be to diagnose bipolar Roman II disorder without verifying the absence of any prior manic episodes, as this would mischaracterize the client's history and potentially lead to inappropriate treatment. Similarly, diagnosing cyclothymic disorder without establishing the required duration and pattern of less severe mood fluctuations would be a diagnostic error. These incorrect approaches violate the ethical principle of competence, as they demonstrate a failure to apply diagnostic knowledge accurately, potentially leading to harm to the client through misdirected treatment. The professional reasoning framework for such situations involves a systematic diagnostic process. This includes gathering a thorough client history, conducting a mental status examination, assessing symptom severity and duration, and differentiating between mood disorders based on established diagnostic criteria, e.g., DSM-5. It also involves considering differential diagnoses and ruling out other conditions that may present with similar symptoms. Professionals should consult with supervisors or peers when diagnostic uncertainty exists, and prioritize client safety and well-being in all diagnostic and treatment decisions. Question 18. Governance review demonstrates that a social worker is seeing a client who reports experiencing sudden episodes of intense fear accompanied by rapid heart rate, shortness of breath, and a feeling of impending doom. The client states these episodes occur unexpectedly and are significantly impacting their ability to function in daily life. The social worker suspects panic disorder. What is the most appropriate next step for the social worker? Option A. Advise the client that these symptoms are common and can be managed with relaxation exercises. Option B. Refer the client for a medical evaluation to rule out underlying physiological causes for the symptoms. Option C. Focus solely on exploring the client's childhood trauma history, as this is a common root of anxiety disorders. Option D. Immediately begin cognitive behavioral therapy techniques focused on managing panic attacks. The correct answer is D. Immediately begin cognitive behavioral therapy techniques focused on managing panic attacks. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a client's presenting symptoms, while suggestive of a specific disorder like panic disorder, could also be indicative of other underlying medical or psychological conditions. The professional's responsibility is to conduct a thorough assessment to differentiate between these possibilities, ensuring accurate diagnosis and appropriate treatment planning, thereby avoiding misdiagnosis and potentially harmful interventions. The challenge lies in balancing the need for prompt intervention with the imperative of comprehensive evaluation. Correct approach analysis. The correct approach involves a comprehensive biopsychosocial assessment. This aligns with the ASWB clinical exam's emphasis on a holistic understanding of clients, which includes exploring biological factors, medical conditions that can mimic panic symptoms, psychological factors, anxiety disorders, trauma history, and social factors, stressors, support systems. This thorough assessment is crucial for accurate diagnosis, as outlined in diagnostic criteria such as the DSM-5, and for developing an individualized treatment plan that addresses the root causes of the client's distress, adhering to ethical principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach is to immediately initiate treatment for panic disorder based solely on the client's self-report of panic attacks. This bypasses the essential diagnostic process and risks treating the wrong condition, potentially delaying appropriate care for an underlying medical issue or a different mental health disorder. This failure violates the ethical obligation to provide competent and evidence-based services. Another incorrect approach is to focus exclusively on psychological interventions without considering potential medical contributors. Many medical conditions, such as hyperthyroidism, cardiac arrhythmias, or respiratory issues, can present with symptoms that mimic panic attacks. Neglecting to rule out these possibilities through appropriate medical screening or referral is a significant ethical lapse and a failure to adhere to best practices in clinical assessment. A third incorrect approach is to dismiss the client's symptoms as simply stress-related without further investigation. While stress can exacerbate anxiety, attributing panic attacks solely to stress without a thorough differential diagnosis is an oversimplification. This approach fails to acknowledge the complexity of panic disorder and its potential co-occurrence with other conditions, thereby limiting the scope of effective treatment. Professional reasoning. Professionals should approach clients presenting with panic-like symptoms with a systematic and thorough assessment process. This involves active listening, gathering detailed symptom history, exploring onset and triggers, and assessing the impact on functioning. Crucially, it includes a differential diagnosis phase to rule out medical conditions and other psychiatric disorders. Collaboration with medical professionals is often indicated. Treatment planning should be evidence-based and individualized, informed by the comprehensive assessment. Ethical guidelines and professional standards mandate a diligent and comprehensive approach to diagnosis and treatment. Question 19. Compliance review shows a social worker is seeing a client who has expressed a strong interest in exploring their attachment style, specifically referencing Bowlby and Ainsworth, and has requested that all therapy focus on this theoretical framework. The social worker has concerns that a sole focus on attachment theory may not fully address the client's complex presenting issues, which include significant anxiety and interpersonal difficulties. What is the most ethical and clinically sound course of action for the social worker? Option A. Conduct a thorough assessment of the client's presenting problems and determine if attachment-based interventions are clinically indicated and appropriate, educating the client on the rationale for the chosen therapeutic approach. Option B. Immediately agree to focus all therapy on attachment theory, as requested by the client to ensure client satisfaction and maintain the therapeutic alliance. Option C. Dismiss the client's interest in attachment theory as irrelevant to their presenting problems and proceed with a different, predetermined therapeutic modality. Option D. Attempt to integrate attachment theory superficially into sessions without a comprehensive assessment, to acknowledge the client's request while addressing other issues. The correct answer is A. Conduct a thorough assessment of the client's presenting problems and determine if attachment-based interventions are clinically indicated and appropriate, educating the client on the rationale for the chosen therapeutic approach. Explanation. This scenario presents a professional challenge because the social worker must balance the client's expressed desire for a specific therapeutic approach with the ethical obligation to provide evidence-based and appropriate interventions. The client's understanding of attachment theory may be limited or misapplied, necessitating careful assessment and education rather than immediate capitulation to a potentially unsuitable request. The social worker's duty of competence and informed consent requires them to assess the client's needs thoroughly and explain the rationale behind recommended interventions. The correct approach involves assessing the client's current functioning and presenting problems, then determining if attachment-based interventions are indeed the most appropriate and evidence-based for their specific situation. This approach prioritizes client well-being and adheres to ethical standards by ensuring interventions are clinically indicated and delivered competently. It aligns with the ASWB Code of Ethics, particularly the standards related to competence, informed consent, and providing services based on appropriate professional knowledge and values. The social worker must educate the client about their assessment and the rationale for the chosen therapeutic direction, even if it differs from the client's initial request. An incorrect approach would be to immediately agree to use only attachment-based interventions without a thorough assessment. This fails to uphold the standard of competence, as it bypasses the necessary clinical evaluation to determine the most effective course of treatment. It also risks violating the principle of informed consent, as the client may not fully understand the implications or suitability of such an approach for their presenting issues. Another incorrect approach would be to dismiss the client's interest in attachment theory outright. While the social worker may determine that a direct application of Bowlby or Ainsworth-specific styles is not the primary intervention, dismissing the client's expressed interest can damage the therapeutic alliance and fail to explore potential underlying themes that may be relevant to attachment. This approach lacks sensitivity to the client's perspective and can be perceived as judgmental. A third incorrect approach would be to attempt to apply attachment theory in a superficial or ungrounded manner, simply to satisfy the client's request. This would be a failure of competence and could lead to ineffective or even harmful treatment. The social worker must have a strong understanding of the theory and its application, and only use it when clinically appropriate and supported by evidence for the client's specific needs. The professional decision-making process should involve 1. Active listening and empathy to understand the client's request and underlying motivations. 2. Comprehensive assessment of the client's presenting problems, history, and strengths. 3. Clinical judgment to determine the most evidence-based and appropriate interventions. 4. educating the client about the assessment findings and the rationale for the proposed treatment plan, including discussing alternative or complementary approaches. 5. Collaborating with the client to develop a mutually agreed-upon treatment plan, ensuring informed consent. Question 20. The monitoring system demonstrates a pattern of inconsistent attendance at substance use disorder treatment sessions by a client who is a parent. The social worker has observed signs of neglect in the child's hygiene and nutrition. What is the most appropriate course of action for the social worker? Option A. Advise the client that continued inconsistent attendance will lead to mandatory reporting and potential child protective services involvement. Option B. Immediately initiate a report to Child Protective Services due to the observed neglect and the client's inconsistent treatment attendance. Option C. Conduct a comprehensive assessment of the child's safety, explore the reasons for the client's inconsistent attendance, and consult with supervisors to develop a plan that prioritizes the child's well-being while supporting the client. Option D. Focus solely on the client's substance use disorder, encouraging them to attend treatment and defer addressing the child's condition until the client's substance use is stable. The correct answer is B. Immediately initiate a report to Child Protective Services due to the observed neglect and the client's inconsistent treatment attendance. Explanation. This scenario presents a professional challenge due to the inherent tension between client confidentiality and the duty to protect vulnerable individuals, particularly when substance use is involved. The social worker must navigate these competing ethical and legal obligations with careful judgment. The correct approach involves a multifaceted strategy that prioritizes client safety and well-being while adhering to legal mandates and ethical principles. This includes a thorough assessment of the client's current substance use, its impact on their ability to care for the child, and the availability of support systems. Crucially, it necessitates consulting with supervisors and potentially legal counsel to ensure compliance with reporting requirements and to explore all available interventions before considering out-of-home placement. This aligns with the ASWB Code of Ethics, which emphasizes the social worker's responsibility to protect clients from harm and to advocate for their best interests, while also recognizing the legal obligations to report child abuse or neglect. The principle of self-determination is balanced against the need for safety. An incorrect approach would be to immediately report the situation to Child Protective Services without a comprehensive assessment and exploration of less restrictive interventions. This fails to uphold the client's right to self-determination and may unnecessarily disrupt the family unit, potentially causing more harm than good. It also bypasses the ethical obligation to seek supervision and explore all available resources to support the client in maintaining custody. Another incorrect approach would be to solely focus on the client's substance use without adequately assessing the immediate risk to the child. While substance use is a significant factor, the critical determinant for intervention is the actual or potential harm to the child. This approach neglects the nuanced assessment required by ethical guidelines and legal statutes, which focus on the child's safety. A third incorrect approach would be to dismiss the concerns due to the client's stated commitment to sobriety, without independently verifying their progress or assessing the ongoing risk. This overlooks the unpredictable nature of addiction and the potential for relapse, which could place the child in immediate danger. It also fails to acknowledge the social worker's duty to ensure the child's safety, even when the client expresses good intentions. The professional decision-making process in such situation should involve a systematic approach. 1. Conduct a thorough risk assessment of the child's safety, considering the parent's substance use and its impact. 2. Engage in active and empathetic communication with the client to understand their situation and explore potential solutions. 3. Consult with supervisors and colleagues to gain diverse perspectives and ensure adherence to ethical and legal standards. 4. Explore all available resources and interventions to support the client and family, prioritizing least intrusive measures. 5. Document all assessments, interventions, and consultations meticulously. 6. If, after all other avenues are exhausted and the risk to the child remains significant, proceed with appropriate reporting or protective actions in accordance with legal mandates.